Hello friends, welcome to Endo Tales from Life. In this video, we are going to see one of the most requested topics in recent times. Yes, it is about the class 2 matricing technique. We are going to see how to choose from among the different matrix systems available in the market and also how to use them with video and pictorial demonstration. And as usual, we are going to keep it as simple and as clinically relatable as possible. So let's see the demonstration. And I like to begin with the disclaimer that I do not have any financial interest towards any of those products shown in this video. Just that I'm just showing the product that I've been using for the past few years and that has worked well for me in my clinical scenario. So the three systems that we are going to see today are: number one is the saddle matrix system, and number two is the sectional matrix system. Both of this are from the brand Tor VM. And the third is the Palodent system, the Palodent Plus system from Dentsply. At the end of the video, you will be able to decide among which one, how to mix and match between all these three systems and which one is more suitable for you. The first system that we are going to discuss is the saddle matrix system. I can say this is one of the most simplest matrix system that is possible to use, and it's also easy for beginners especially because it's both economical and it's also very easy to use. And as you can see, you will, when you buy the starter pack, you will get a clip like this, which is basically the holder for the matrix band, and you also get these different matrices band, and the medium size is the most commonly used. So this is the type of clip that is a replacement for the matrix band retainer or the forceps. All of them are not needed for the system. You just need this clip and the matrix band, that's it. And among the thickness, there are two thickness available. One is 50 microns, another one is 35 microns. The demonstration that we're going to see here, and my personal choice is basically 35 microns. So this is how the matrix system looks once you assemble and it's ready to use. And in this video you will see how we are going to use this matrix system. So basically this saddle matrix comes with two slots in the end of the band where you place the clip. Like I mentioned, it's one of the easiest and simplest to use. And now just press the other side of the clip, which opens up the clip, which enables me to place the matrix band in the class 2 situation. And you can see it's self-adapting, and all I have to do is to select a proper wedge, and you can see here the wedge here is too small. Now I move to a bigger size wedge, and that's it. So now you'll understand why it's one of the simplest system. And along with the system, you do not get wedges. So if you're using this system or the Tor VM sectional matrix system, you need to additionally buy some wedges from the market. And one of the brand that I've been using for the recent time is a brand called Reborn Endo. You get these assorted wedges. All of them are anatomically shaped. They're also available in different sizes. As you can see, it's triangular in shape, and the base actually faces gingival side, and it's shaped in the shape of the embrasure, whereas occlusally you have a pointed tip, which creates a more anatomically resembling embrasure space after your class 2 restoration. And we generally advise to place this wedge even before you do the class 2 cavity prep, so that there is also, this is called pre-wedging, which will give some separation and which will also protect the gingival tissue from getting damaged during a cavity preps. And this is how saddle matrix can be used in during the, if it's an MO cavity, I make sure the concavity of the matrix band is away from me. Whereas if it's a DO cavity, you place the clip and the matrix band in such a way the concavity of the matrix band is facing you. So this way you can apply the system for both the MO and DO, and you can see class 2 that I have restored post endodontically. With just a saddle matrix system, you can see a beautiful embrasure space that has been created with these anatomically shaped wedges. But what I'm concerned about is when you really go closer, you can see there is a little bit of space. I've not got the tightest of the contact that I would really want. It's because of the thickness of the matrix band, and also because of something called the interdental separation that is not created by this passive matrix band retainer, which is, I would say, one of the limitation of this matrix band. So when it comes to the saddle matrix system, when I have to talk about the pros or the advantages of this, I like it because it's very simple and economical. There's no need of extra forceps or clamps or the matrix band retainers, and it's also more stiffer. So it's good for some cervical hip buildup, which I will show you in the upcoming slides. On the flip side, like it showed you a demonstration, it may not give you the tightest of the contacts. So this is the cost of the saddle matrix system at present in the Indian market. When you buy them, you also need to additionally buy some good wedges. So where exactly I use the saddle matrix is when I'm not particular, or when I'm not permanently building the contact in a class 2, like when I'm just doing a core buildup for a tooth where I'm going to again do a crown prep and break the contact later, or when I'm doing a deep margin elevation to just build the cervical hip of the class 2, that is where I'll be using my saddle matrix. As you can see here, there's a deep class 2, and following my endo, you can see the saddle matrix has these nice gingival extensions and they're stiff, very good for building the cervical hip. You can see the kind of anatomy that I have built with this, and this is only a temporary contact that I have built because this tooth, when I'm going to place a crown later, I'll be breaking the contact anyway. So when I'm not particular about the tight contact, or when I want to do a deep margin elevation, these are very good matrices and very economical, saves a lot of time as well. You can see again a subgingival cavity. After my endo, I place my saddle matrix and use my composite to elevate the margin so that I can place the margins of my indirect restoration supragingivally. This is called this deep margin elevation, for which the saddle matrix is extremely beneficial. Another situation, you can see radiographically, you can appreciate the beautiful contour and the deep margin elevation that is created with the saddle matrix, where I'm not going to restore above the contact, I'm not going to build the contact here. So my saddle matrix is good enough for such situations. And in fact, when I do my deep margin elevation, I don't even use the clip. I just place the band and a wedge, which is good enough for me to get the cervical buildup. You can see there is a small gap in the near the gingival seat, which can be adjusted by just placing a good wedge, and following which I can just complete my deep margin elevation and go ahead with my indirect. Another situation where I've done a deep margin elevation. As you can see, this is the deep margin elevation that I've done with the saddle matrix, following which I've gone ahead with my indirect. So this is where I personally use my saddle matrix. Then comes the second matrix system that we have for today, that is the Tor VM sectional matrix system. And here again, my choice of thickness of the matrix band is 35 microns or 0.035 millimeters. And the basic principle of this sectional matrix is, the idea is to get tight contact. This is achieved by placing these rings. These are called G rings. When you place them internally, they not only hold the matrix band, they also create interdental wedging forces, or they separate the tooth, which enables you to adapt the composite when the teeth are separated. When you pack the composite, when you build the proximal wall, and later when you release or when you remove the ring, the teeth are going to come back together, which gives you real tight contact. That's the basic principle of these sectional matrices. So with Tor VM, you get two types of rings. You need to be careful about, or you need to be choosy about what type of ring that you use. The G ring that you buy, the older type of ring that you can see on the left, do not have a space for placing wedges, whereas what you need to ask for is the delta ring, which has space for placing the matrix band. So this is what I mean by the old type ring, which will not give you space for placing wedge. The wedge plays a very important role for us to create the gingival embrasure and prevent overhangs. So the delta wing of the Tor VM matrix band gives you that space. You can see here, in spite of causing tooth separation and holding the matrix, it also gives you space for placing these good wedges. Right. So when you have to use these section matrices from Tor VM, you need to either buy the forceps from the manufacturer, or alternatively you can also use the rubber dam forceps that you already have in your clinic. You have in your clinic. And among the two types of rubber dam forceps, the one you see on the left is Strokes forceps, and on the right is the ivory forceps. And I personally prefer the ivory forceps for this purpose. So you can see here, I'm going to place the delta ring, and the delta ring, like I mentioned earlier, gives enough space for placing the wedge. The wedge further can cause some tooth separation, and also makes or maintains the embrasure space, and which is very important for the gingival health. Right, so now let's see the demonstration of the Tor VM sectional matrix. This is how the pack comes. And the medium size is most commonly used for molars. See, I just place them. They are pre-contoured. I place them interdentally, and I always place the wedge even before placing the retainer or the ring. And one of the drawbacks with these rings are they're difficult to handle. You can see I'm using my rubber dam forceps, and even if you use the forceps given by the manufacturer, they tend to slip. And these rings are made of stainless steel, so it's pretty hard to retract them. You can see the ring slipping when I'm trying to use it. This is some difficult. That's why I haven't edited this part, for you all to know that this ring is not the easiest to handle. You need some practice, and once placed, it gives a nice adaptation. It causes the interdental separation as well, like I mentioned. And after you have finished the class 2, this is the sequence of removing. You first remove the ring, then we remove the wedge, and then you remove the matrix band. So the critical analysis of this Tor VM sectional matrix system plus the delta ring is, on the good side, it's very economical and you can achieve good tight contacts as well. But the flip side is, yes, you need additional forceps, and these rings are made of stainless steel, so it's a little difficult to handle. And like you saw in the video, the ring can keep slipping when you're trying in the patient's mouth, which is kind of difficult for beginners to start with. So this is the cost of this kit in the Indian market right now. And personally, for me, I have used the system before I started using the Dentsply system. So yes, you can achieve really good contacts and contour with this if you can handle the ring effectively. If you get used to this ring, you can see in this particular scenario, I'm not going for an indirect, I'm going to go for a direct only. So I have placed the matrix band, placed the wedge, and placed this delta ring, and I was able to get pretty decent contacts with this. So now let's see the third system that is present in the market, that is the Dentsply's Palodent system. And the Palodent system, as you can see here, comes as an entire package where you have the forceps, you have a pin tweezer, you have bands of different sizes, you have two rings of different sizes, and also a wedge guard and a wedge. We'll be talking more about the functions of wedge guard in another video. I don't want to make this video too long. So this is the basic difference between the Palodent ring, which is also a sectional matrix ring, and the delta ring. The difference is that this is fabricated in such a way that it does not slip and it's much easier to handle, and this ring is made of nickel titanium, so it's more flexible, and also when it comes back the forces are going to it's going to cause more interdental separation than what you achieve with the stainless steel ring or the delta ring of the Tor VM matrix. And there are two sizes of rings. On the left you see the dark blue ring is basically for narrower teeth like premolars, whereas the light blue on the right side is for broader teeth or molars. So they give you the forceps separately, which is custom made just for the ring. It's not like how you use a rubber dam forceps for this, where it may again slip. So we recommend to use the manufacturer provided forceps for this, and you can see this is how the this forceps for this clamp is, and it gets nicely adapted to the ring. And as you can see in this video, it doesn't slip because there is a slot in the clamp in the ring for this, and you can see the separation is much more easier. So the placement of the ring and removal of the ring is also easier with this dense splice matrix system. And additionally they give you a pin tweezer, which is useful for picking up the matrix band, and the wedge both will have a slot where the pin can be useful to maneuver intraorally where there is less working space, like this. And the pin tweezer also at the end has a ball burnisher, which is used for burnishing the matrix band, which I'll show during the demonstration. And these are the wedges from the dense ply, which is also anatomical. And what I like compared to the previous wedges is it's more stiffer, so it's easier to place it in the embrasure space. And these are also anatomically shaped, and they come in three different sizes, the dark blue being the thinnest and the lightest blue being very thick. So here's the demo. As you can see, this is very fragile and thin. They are also almost 36 micron in thickness, and owing to the matrix band's thickness and softness, you get the tightest contacts with these type of band. Once I place the band, then I place the wedge depending on the size of the interdental embrasure. Select the wedge, and since it's molar, I'm using the light blue band, light blue matrix band retainer or the ring, and that's it. Now I use the ball end of the pin tweezer to burnish the band against the opposing wall. Then once you finish your class 2, removal is also pretty easy. It's the same sequence. We first remove the ring, then the wedge, and then you can use the pin tweezer to pull out the band. In the clinical scenario, after creating a very tight contact, if you're not able to remove the band, you can even use a small artery or a needle holder to pull this out. So now let's critically evaluate this system. The good things is it's a very easy and effective system, and I've been using it for the past 3 or 4 years now. And the night tie ring, it's very flexible, so it's easy to place. And according to the manufacturer, they claim there is an up to 4 kilogram interdental force, which causes an adequate tooth separation, which results eventually in extremely tight contact. But the other side is obviously the cost when you compare to the other two systems. But I personally feel it's a one-time investment, because once you buy it and later you can just get the refills of the bands and even the wedges from the other alternate companies. So this is the current cost in the Indian market, and you can see here, wherever I want a permanent tight contact where I'm not planning indirects later, I always prefer to go with the Palodent system, Palodent Plus system, for applying the matrix band and the retainer. You can see the kind of morphology and the tightness of contact which you will not be able to get easily with the other two systems. Look at the contacts tightness here. Another situation, again you can see the morphology and contact. And this is a interesting scenario where the patient developed cavity on both sides of the crown that she's already wearing. So the patient was not happy with crown, so they did not want crown, they wanted a permanent restoration. So I was very particular in building the contacts, and you can see I was able to get real tight contacts with the Palodent Plus matrix system. Here another situation where the final restoration here is just a class 2 composite. So it's very particular about getting the contact tight and the contour right. And so before we end, if you ask me personally, I mix between saddle matrix and the Palodent Plus system. I have both the Palodent and the saddle. So like I mentioned, for the deep margin elevations or where I'm not going to build a permanent contact, I just finish the case with saddle. Or cases where I may have to build a permanent contact, or where may have to do a permanent class 2, but the drawback with the Dentsply's matrix band is it's too thin and fragile, which may sometimes cause collapse of the band when the width of the class 2 is wider. So when the width of the class 2 is really wide, I go for the saddle matrix, which is also the 35 micron thickness, but it's little stiffer. So I place that as my band, but I use the Dentsply's Palodent matrix ring and also wedge, good wedge, and I get decent and nice tight contacts. So this all mix and match among all the matrix bands and retainers and wedges that I have in my practice. Again, another situation of the mix and match of what I do. But ultimately, I want a good embrasure and tight contact. That is what we really need, isn't it? So for people, I know there will be questions regarding where to get all these materials from. So these are the dealers from whom I personally buy. So there may also be other dealers dealing with this material. So it's up to you to get them and start using and do good class 2s. So what I might have missed is certain other good matrix systems like the Garrison or the BioClear. Personally, I haven't used them, but yes, there are a lot of other brands of class 2 matrix systems as well that is available. And they all work with the same principle. And once you understand the principle of choosing between the type of matrix, the wedge, and the ring, you will decently get good contacts with all these matrix systems. Thank you so much, and meet you soon in my next video.